Okay, coming onto the scene, I'm going to check and make sure the scene is safe for me and my crew. Also noting any weather that might be in the area, the time of day, and any other considerations that might be happening in the scene. I'm also going to make note of any bystanders that are nearby. My crew and I will also make sure that we've donned the proper BSI or PPE. If there are no bystanders at the scene, I'm going to go into my general impression, which appears to be a late 20s, early 30s male who's 60 feet away from a motor vehicle accident. At this time, I'm going to have one of my crew come and take manual stabilization of his head and C-spine. While they're doing that, I'm going to kneel down next to the patient, see if he responds to any verbal commands. Sir, are you okay? If no response to verbal, then I'm going to go into to see if he responds to any pain stimulus, where I'm pinching the trap on the left or right side, or the earlobe closest to me. And then from there, I'm going to go into checking his airway and breathing. By doing that, while my partner is taking manual stabilization of the head and C-spine, I'm going to do a jaw thrust. As I'm doing the manual jaw thrust, I'm also going to lean over, listen for his breathing, try to see if I can feel it, also while looking for his chest to rise and fall. Depending on if there are any issues with his airway, I'm going to insert an OP or NP and see if anything needs to be suctioned. If nothing needs to be suctioned, or I've suctioned everything out of the airway, I'm going to apply a bag valve mask at a rate of 12 to 20 breaths per minute at 15 liters with 100% O2. Once all of that is done, then I'm going to go down, check for JVD or tracheal, any tracheal issues. If I don't see any from there, then I'm going to get his pulse at his peripheral and carotid arteries, and also making note of his pulse rate and heart rate from there. And if that is all going good, I'm going to expose the patient's chest either by trauma shears or lifting up the shirt. I'm going to make note of any deformities, anything else that might be out of the ordinary. And then from here, I'm going to go into my chunk checks. By doing that, I'm just going to start behind the head, periodically checking my gloves to see if there's any blood, moving around the body. And what we're checking for is to see if there are any life-threatening injuries. If there are no life-threatening injuries, you can move on to the next part of your assessment. But periodically checking your gloves to make sure there's no blood ensures that you're not missing anything. If there is no blood found, then what I'm going to do is make note of the patient's skin color, temperature, and appearance. Once I've noted the patient's skin color, temperature, and appearance, I'll make a determination if the patient is a priority, have one of my crew go get a longboard and a neck support, and then see if there are any other bystanders to provide history.